Then we come on to the treatment of neck pain and back pain problems. In the treatment, it is very important for us to understand what is the cause of the underlying problem. So once we treat the cause, we get proper results. Let us start with younger age patients. In younger age, the common problems are abnormal postures. As I mentioned, the IT professionals or people who are in the offices working for longer hours in the banks and other establishments, they will be continuously sitting in front of the system and operating the systems. So it's important to, here there is no much of spondylosis, there is no much of bone problems, only problem is there with the postures. So here we can advise them proper posture maintenance. So there will be some good exercises which we advise them to improve the muscle strength and muscle power and to reduce the spasm of the muscle which gives rise to the pain. So thereby we make use of certain medicines also which helps to relieve the spasm, and also it's important to see if any correctable problems like B12 or vitamin D deficiency is there or not. We look at it and treat that problem. So this is when it comes to the posture problem, these are the treatment options that are available. We also have the use of physiotherapy. In the physiotherapy, we have different techniques like IFT as well as the ultrasonic therapy and TENS, which can be used to correct these issues. Other than that, when you come to the spondylosis, particularly for the spondylosis, once we make a proper diagnosis with the help of the appropriate imaging, which includes X-rays and MRIs, and also with the nerve conduction study analysis, we make the diagnosis of the degree of compression and the degree of spondylosis. Then we advise the treatment which includes proper supplements to improve the bone strength, to improve the flexibility of the joints, to improve the bone mineral density, and we also advise medicines which will improve the muscle strength. So here it is not just painkillers to reduce the pain, but it is a complete disciplinary approach to rectify the underlying disease process or to stop the underlying disease process. It is very important to reverse the problem or try to focus on treating the underlying disease. That will give long lasting relief to the patient. So here we aim at using all these techniques, the treatment techniques to treat these problems. Other than that, we make use of the same physiotherapy techniques which I mentioned earlier. They are very useful even for spondylosis problems. When it comes to problems like rheumatoid arthritis, ankylosing spondylitis and other bone related diseases, specific treatment options are available which includes drugs, and also appropriate drugs are there, appropriate medicines are there, and we have a role of physiotherapy in these situations also. In certain difficult situations where the disc compression is very severe or the nerve damage is more, we advise surgical treatment for those patients, and then the rehabilitation, physiotherapy and rehabilitation will follow. So thereby a complete holistic approach, a complete thorough evaluation and a total proper plan of management has to be done for these patients to achieve the best results and long lasting results. It's very important to give them long lasting results. With all these available options, we are able to treat these patients in a very successful way. So thank you for your patient listening. I hope you have enjoyed and got some information about this particular very common topic of neck pain and back pain. Thank you so much.